Hi, I'm Dr. Alex Matheson from Matheson Dentistry. We get a lot of questions here about tooth cavities, and that's what we deal with on a daily basis is tooth cavities. So today I'm going to be answering some common questions that we get about cavities in hopes that we can give you a better understanding of this topic. So dental cavities are when the bacteria that live in our mouth will basically create a hole in our tooth. Um, the way they do that is they secrete acid, and that acid pulls the minerals out of our teeth. And at a certain point of demineralization, the tooth just cavitates in, and there's a literal hole in the tooth. And that hole will continue to progress and get bigger and bigger and bigger until it gets into the middle of the tooth where the nerve is on our tooth, and that's when things go south because it starts hurting. So that's what a cavity is. So cavities are caused by the acid that the bacteria make inside of our mouth. So all of us have bacteria, and that's not necessarily a bad thing. That's just normal. We all have bacteria in our mouth. But when we don't brush and we don't floss appropriately, then those bacteria will really replicate more than we want in our mouth, and they'll create the plaque. That's the white gooey stuff that gets on our teeth. And when it creates that plaque, it's this perfect little environment for the cavities to secrete this acid all over our teeth that pulls the minerals out of our teeth. So it's really the bacteria in our mouth that are causing these cavities. So when a dentist is checking for cavities, there's a couple of things that we do. One is we're going to take x-rays because you can't visibly see small cavities when in between teeth. And so it's really important to take x-rays because on an x-ray we can see cavities that are starting to form in between the teeth. And that's when we want to catch them, is when they're smaller. The other way that you can look for cavities is with the Dental Explorer, and many of you know exactly what that is. It's that little pokey thing that scratches around on your teeth, and that's what we're looking for. We're looking for any areas that are soft when we press in certain areas of your teeth, because that's what it'll feel like on your tooth. If there's a little soft area, you know that that's a cavity. So cavities can spread. Certainly, it'll spread on the tooth that it's on. It'll continue to get bigger and bigger and bigger. But oftentimes, when there's a cavity on one tooth, it kind of sets up a situation where there's a high level of bacteria in that area, and that bacteria, which is producing acid, can also infect the tooth right next to it. So yeah, it definitely can spread. First stage of a cavity, the bacteria is pulling minerals out of our teeth, and oftentimes it'll cause some discoloration of teeth. Sometimes we'll see like a really white kind of chalky area on the tooth. So that's the demineralization phase. And then after that demineralization phase, it will cavitate, or really like literally just create a hole in the tooth. And that's when we definitely need to get in and get things taken care of. That cavity will continue to spread. At first, it's just in the enamel or the outer layer, but then it'll spread into the dentin, which is the undersurface right underneath the enamel. And when it's in the dentin, the cavity will actually go quite a bit faster than when it's in the enamel. And then ultimately, it will get to the nerve of the tooth. And this is typically when you're calling into the dentist out of necessity because it really hurts. Our goal is to really stop cavities before this, and so that's the reason why we encourage everybody to come in for their 6-month checkups so that we can look for cavities, we can take x-rays, we can feel your teeth, and just make sure we can stop cavities when they're smaller. So at the very beginning stages of a cavity, when it's just demineralizing, it is possible to reverse that process. And there's a lot of things that we can do. The first and most important thing that you can do is appropriate brushing and flossing. And one of the things that our amazing hygienists here at Matheson Dentistry will do is they will go over brushing and flossing and how to appropriately brush and floss your teeth. So that's going to really help. The other thing that we'll encourage you to do, especially when we're starting to see a cavity form, is we'll encourage some alternative form of fluoride. Obviously, we want to get fluoride from our toothpaste, But another thing that we can do here in the office is use what's called silver diamine fluoride, or SDF. And this is a great drug because what it does is it can actually reverse the process. When we're starting to see a cavity on an x-ray, you can use this SDF, or silver diamine fluoride, and it's been shown to reverse that process. It can stop the cavity, or sometimes it even reverses it and just totally takes it away. So that's one of the reasons why we highly recommend coming in every 6 months. We can take those x-rays. If we see a cavity just starting to form, oftentimes we won't have to go in and drill on it. We can use this silver diamine fluoride and stop it that way. So the best way to stop a cavity from progressing, again, if it's small enough, we can use what's called silver diamine fluoride to stop the process of a cavity. Once the cavity gets to a certain part of the tooth, once it gets through the enamel or that outer layer of the tooth and it cavitates in, that's when we really just have to go in and physically remove the cavity. And that's obviously where we get you numb, we drill out the cavity, and then put a filling in. And so that's really the best way to stop a cavity once you have a true cavity formed, is to get in there, drill it out, remove it from the tooth, and then put a filling in. So how long a cavity filling will last depends on a lot of things. One, it depends on the dentist. We need to make sure that we do a good job so that the edges of the filling, the margins of the filling are closed and very well sealed on your tooth. The other thing that's going to really help the longevity of a cavity is home care, and that's probably the most important thing. So really important when you have a filling to floss every day, brush 2 times a day, use a fluoridated toothpaste, and then come in every 6 months so that we can check all of your teeth, including the teeth that have fillings, because we want to make sure that those fillings stay there for a long time. So if all of these things are done well, if we do our job right, and you do your job with home care, with brushing and flossing and using a fluoride toothpaste, then fillings can last a long, long time, years and years and years. And that's what we really want. So professional dental cleanings here at the office that are usually done on a 6-month basis go a long way to helping to prevent cavities. What the hygienist is going to do is she's going to remove the plaque that forms on our teeth. That's where those bacteria hide out. She's also going to remove the tartar that builds up on our teeth. And what the tartar is, it's the plaque that has solidified because of the minerals in our teeth. So it's kind of like that, that little crusty stuff that you get around the sink faucet. It gets kind of hard and crusty. That's what happens basically on our teeth, is we get that stuff that forms, and that's called the tartar or calculus. And so it's really hard to get that off. You really can't get that off with a toothbrush or floss. And so that's why you got to come in and have the hygienist scrape it off or use the ultrasonic scaler that vibrates it off. And that's going to go a long ways to helping prevent cavities and gum disease, because those little deposits on our teeth are the little home for all those bacteria to live and replicate and do all kinds of bad stuff on our teeth. So the other thing that the hygienist can do once she gets all the plaque and tartar off your teeth is do a fluoride treatment. Now, it's really important that we're using topical fluoride on our teeth every day when we're brushing with our toothpaste. But a fluoride treatment here at the office really helps a lot as well, because it's a much, much higher dose of topical fluoride on our teeth, and it can really help to prevent cavities. So if you suspect that you have a cavity, best thing to do is call us here at Matheson Dentistry, 480-888-8123. We'd be happy to get you in for a free no-cost consult and just take a look and see if there's anything that we need to do, see if there is a cavity going on. We can take x-rays, we can look at your tooth, we can feel with that explorer and see if you have any cavities. Certainly if you're having sweet sensitivity, if you're eating candy or something like that, and you just really is sensitive on that tooth, having cold sensitivity, those are really big signs that you might have a cavity on your tooth. So if you're having any of those kind of symptoms, please give us a call here at the office and we'll get you in as soon as we can so we can take care of that tooth. So not brushing teeth is a big reason for getting cavities, but there's other reasons. In fact, there's probably bigger reasons. The other bigger reasons are flossing. So there's kind of the saying in dentistry: you only floss the teeth you want. You only floss the teeth you want to keep. Flossing is really important. So brushing is very important, but brushing doesn't really clean in between the teeth, and that's where most of our cavities actually form, is in between the teeth. So flossing is huge. You got to floss. I mean, if you were doing one or the other, flossing might even be more important than brushing. They're both important, so make sure you do both of them. The other thing that's really important is using a fluoride toothpaste. So I've just seen this, and I know that some people may have some issues with fluoride, and that's fine. I don't want to downplay that. But it is true that when people maybe switch to a non-fluoride toothpaste, you can almost bet that they're going to start getting more cavities. I see it so often and so frequently that someone will decide that they don't want to have any topical fluoride in their mouth, and that's obviously a decision up to them. But when that happens, almost immediately they start forming cavities. So brushing super important, flossing is super important, and using fluoride toothpaste super important to helping to prevent cavities. And then also the other part of that is coming in every 6 months so the hygienist can keep your teeth nice and clean. We can use topical fluoride treatment on your teeth to prevent cavities. So if a cavity hurts, it's never too late. We always want you to call and come in. If it's hurting, sometimes that is a sign that you may need more than just a filling. And it actually depends on kind of the quality of the pain. So let's just say you drink something cold and it kind of gives you a quick zing that just dissipates after 5 or 10 seconds. That's not necessarily a sign that we're going to have to do anything different than just doing a filling. But if you get something cold on your tooth and then it kind of zings, and then maybe the initial zing goes away, but then there's kind of a toothache for 3 or 4 minutes, that is a sign that we probably are going to have to do something else to fix this tooth. So certainly our biggest recommendation is coming in every 6 months so that we can check for small cavities, because that's where we want to catch them. If you are having any symptoms at all, though, we want you to come in just as soon as you possibly can so that we can prevent a root canal, so that we can prevent crowns, so that we can prevent implants. All of those things are, more time consuming, more costly. So it's much better if we can take care of those fillings when they're smaller. So once a tooth has had a filling, it can still get another cavity. And so that's why it's super important to continue to come in every 6 months so that we can take a look and make sure that we're not getting any new cavities on that tooth. Super important that we continue to floss, brush, use a fluoride toothpaste. All of that's going to help prevent cavities in the future, because just because you had a cavity once on a tooth doesn't mean you can't get another cavity, unfortunately. Well, hopefully today I was able to answer some of the questions that you had about cavities. If you suspect that you might have some cavities, or you just want to get checked out and make sure that you don't have any cavities, please give us a call here at Matheson Dentistry, 480-888-8123, and we'd love to get you in for an exam. Thanks.